Notice, the people appearing in the video are for illustrative purposes only. They may not be real doctors or patients. Thank you. Hey everyone. Welcome back to my channel. Today we're diving into a topic that's often misunderstood: depressive personality disorder, or DPD. Depressive personality disorder is more than just feeling sad. It's a pervasive experience that colors every aspect of life. But what exactly is DPD? How does it differ from other forms of depression? And most importantly, what can we do about it? Now let's get started. Depressive personality disorder, DPD, is a complex and multifaceted mental health condition that is characterized by chronic feelings of sadness, pessimism, and a general lack of interest in life. Although it shares some similarities with Major Depressive Disorder, MDD, it is distinct in its persistent nature and the depth of its impact on a person's personality and outlook on life. This video aims to delve into various aspects of depressive personality disorder, including its definition, symptoms, causes, diagnosis, treatment, and the challenges it presents to individuals who suffer from it. Definition and distinction from Major Depressive Disorder. Depressive personality disorder is defined by a pervasive pattern of depressive cognitions and behaviors that are consistent and long-standing. This condition is not widely recognized in many diagnostic manuals, such as the DSM-5, Diagnostic and Statistical Manual of Mental Disorders, 5th edition, but it has been a subject of study and discussion among mental health professionals. Unlike Major Depressive Disorder, which is characterized by episodic and often severe episodes of depression, DPD is more about a consistent and enduring set of personality traits that are depressive in nature. Symptomatology. Unlike episodic mood disorders, DPD symptoms are persistent and deeply ingrained, profoundly affecting the person's worldview and behavior. This essay outlines the key symptoms of DPD, providing insight into this often misunderstood disorder. Persistent sadness. A hallmark of DPD is a constant feeling of sadness that doesn't fluctuate significantly with life events. This mood state is more than just occasional blues. It's a deep-seated sense of melancholy that pervades an individual's daily life. Pessimism. Individuals with DPD tend to have a negative and pessimistic outlook on life. They often expect the worst in situations and can have a generally gloomy view of the future. This pessimism isn't just limited to specific events but is a fundamental aspect of their personality. Low self-esteem. People suffering from DPD frequently struggle with feelings of worthlessness and inadequacy. They might have a persistent belief that they are not good enough, regardless of their accomplishments or the reality of their situation. Social withdrawal. Due to their negative self-view and general disinterest, individuals with DPD may withdraw from social interactions. They might avoid social gatherings, feel uncomfortable in social settings, or have difficulty maintaining relationships. Anhedonia. Anhedonia, or the inability to feel pleasure in normally pleasurable activities, is a common symptom of DPD. People with this disorder may find that activities they used to enjoy no longer bring them happiness. Fatigue and lack of energy. Chronic fatigue and a general lack of energy are frequently reported in DPD. This isn't just physical tiredness but can also manifest as a mental or emotional exhaustion. Difficulty in coping with stress. Individuals with DPD often have a hard time handling stress. They may become easily overwhelmed by everyday challenges and find it difficult to cope with change or stressful situations. Chronic anxiety. Anxiety, often co-occurring with depressive symptoms, is common in DPD. This anxiety is not necessarily tied to specific events but is more of a constant feature of their overall mood. Etiology. Genetic factors. A significant aspect of DPD's etiology is genetics. Studies have suggested a hereditary component to depressive disorders, including DPD. Individuals with a family history of depression or related mood disorders are at a higher risk of developing DPD. This genetic predisposition doesn't guarantee the development of DPD but indicates a higher susceptibility. Research in this area often focuses on identifying specific genetic markers or variations that contribute to the disorder, though the exact genetic mechanisms remain unclear. The complexity of human genetics implies that multiple genes, interacting with each other and with environmental factors, play a role in the development of DPD. Biological factors. Neurobiological factors also contribute significantly to DPD. Neurotransmitters, the chemicals in the brain responsible for communication between neurons, play a crucial role in mood regulation. Imbalances in neurotransmitters like serotonin, norepinephrine, and dopamine are often associated with depressive disorders. Individuals with DPD may have chronic imbalances in these neurotransmitters, leading to sustained mood disturbances. Moreover, brain imaging studies have indicated that people with depressive disorders may have differences in brain structure and function, particularly in areas responsible for mood regulation and emotional processing. Environmental influences. Environmental factors are equally pivotal in the development of DPD. Traumatic experiences, especially in early life, such as childhood abuse, neglect, or loss, can greatly increase the risk of developing depressive personality traits. These experiences can lead to long-term changes in how individuals perceive and interact with the world, often skewing their outlook towards pessimism and hopelessness. Chronic stress, whether from personal relationships, socioeconomic status, or other life circumstances, can also contribute to the development of DPD. These stresses can perpetuate negative thinking patterns and reinforce depressive personality traits. Psychosocial factors. In addition to biological and environmental factors, psychosocial elements play a role. How an individual reacts to and copes with life events, their resilience, and the support systems they have access to can influence the development and severity of DPD. For instance, individuals who lack strong social support or effective coping mechanisms may be more susceptible to developing DPD in response to life stressors. Interplay of factors. The development of depressive personality disorder is typically a result of the complex interplay between these genetic, biological, and environmental factors. It's rare that a single cause can be pinpointed. Rather, it's the combination of these factors, along with individual psychological and social experiences, that culminates in the disorder. Diagnosis. Diagnosing depressive personality disorder can be challenging, as its symptoms overlap with various other disorders, particularly major depressive disorder and dysthymia. A thorough clinical interview that includes personal history, family history, and a detailed discussion of symptoms is essential. Psychological assessments and questionnaires can also be helpful in the diagnostic process. Treatment approaches. Depressive personality disorder, DPD, presents unique treatment challenges due to its pervasive and enduring nature. Effective management of DPD requires a multifaceted approach, combining psychological therapies, pharmacological treatments, and lifestyle modifications. This essay outlines the primary treatment strategies for DPD, emphasizing the importance of personalized care. Psychotherapy. Psychotherapy is central to treating DPD. Cognitive behavioral therapy, CBT, is particularly effective, focusing on altering negative thought patterns and behaviors associated with depression. CBT helps patients identify and challenge distorted perceptions they have of themselves and the world, replacing them with more realistic and positive views. Psychodynamic therapy is another approach, delving into past experiences and emotional conflicts that may contribute to depressive personality traits. This form of therapy aims to increase self-awareness and understanding of the influence of the past on present behavior. Pharmacotherapy. While there are no medications specifically approved for DPD, antidepressants can be beneficial, particularly for those with co-occurring depressive disorders. Selective serotonin reuptake inhibitors, SSRIs, are commonly prescribed due to their efficacy and relatively favorable side effect profile. It's important to note that medication may help manage specific symptoms like pervasive sadness or low energy, but they are typically used in conjunction with psychotherapy for optimal outcomes. Lifestyle modifications. Lifestyle changes are an essential aspect of treatment. Regular exercise, a healthy diet, and adequate sleep can have a significant positive impact on mood and overall well-being. Mindfulness practices, such as meditation and yoga, can also be beneficial in managing stress and promoting emotional balance. Social support. Building a supportive social network is crucial. Support groups, either in person or online, can provide a sense of community and understanding. Encouraging patients to engage in social activities and maintain relationships can help combat the isolation often associated with DPD. And that's a wrap for today's video. Thank you so much for watching. If you found it helpful, please give it a thumbs up. Don't forget to subscribe and hit that bell icon so you won't miss any of our upcoming content.